things that can hopefully benefit everyone. This is basic medical definition of menopause. Specificity, as some women have hysterectomy. And
hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic Dr. Fiona Chin, co-founder of Kidney Disease Solution, Kidney Coach, and our flagship products from Kygenesis. And I'm joined again today by one of my favorite guests, Dr. Alexander Grinberg. Dr. Grinberg is hello. I'm always so glad when you join me. Dr. Grinberg is a practicing physician up there in San Francisco in the US, working with patients in the area of longevity, lifespan, extension, personalized anti-aging, nutritional optimization, lifestyle medicine. So very, very holistic in what he does. He's not only a practicing MD, but he's also got a background in virology. He's also got psychiatry background. He started his medical degree when he was 16, which is just crazy for me. So he's been doing, this is what he's dedicated his life to. In fact, Alex, I think we'd spoken about that you became almost obsessed with longevity and anti-aging from like the age of like 6 or something. So you've really, this has been your life work. Let's dig into what happens in menopause. What is that process that as women joyfully get to go through, and what happens in that? And then walk me through potentially the connection to chronic kidney disease from there.
so I'll briefly give some formal definition, formal knowledge, and we can proceed to very exciting things that can hopefully benefit everyone. So formally menopause means the 12 months, absence of periods for 12 months, and a raise of the levels of FSH, follicle stimulating hormone. This is basic medical definition of menopause. And most importantly, while this definition may lack some specificity, as some women have hysterectomy and they cannot have periods but still enter menopause, and also levels of hormones different depending on certain other comorbid conditions that all have to be considered. But menopause has a key word, estrogen. The estrogen, and when the ovary gets lose all the eggs, the cells, oocytes that gradually progress into the mature eggs, these cells produce the hormone called estrogen. It's known as a main sex female hormone. And the estrogen has a multiple pleiotropic functions in our bodies, both female and male bodies. And obviously, changes of level and significant drop of level of this hormone reflects on function of all organs. And it's well-known connection between endocrine hormonal system and physiological functioning and health of basically any cell in human body, from skin and hair to brain and kidney, so everywhere in the body. So Fiona asked me why some of the patients frequently reported that they develop simultaneous onset of menopause and chronic kidney disease. And it's a very interesting topic because the relations between ovarian health and kidney health is two ways. Definitely kidney health, kidney function affects ovarian function and entire ovarian, pituitary, hypothalamic axis, and definitely function of this hypothalamo pituitary ovarian axis affects kidney, as it affects many other organs. But why some people develop CKD simultaneously? Obviously, they have specific genetic setup, partial or like heterozygous or homozygotes mutations, or particular genetic predispositions that make them or their kidney more vulnerable to respond in a more dramatic and rapid way to change levels of estrogen and some other related hormones. And
Okay.
and also other women that don't develop CKD is a part of population that has subclinical CKD or not just well examined, and they may develop it in the later ages, possibly the what's considered almost normal dropping levels of GFR with age may be related primarily to worsening kidney function with age. Who knows what is the main factor there? And definitely from the research where people get the HRT, hormone replacement therapy, estrogen replacement therapy, many functions, physiological functions, including kidney function, may improve.
Dr. Grinberg, thank you so much. Now, if anyone wants to contact you, infinityepigenetics.com, I'll put the link below. Dr. Grinberg is in San Francisco, but he does telehealth because I send my really complicated patients in Australia here to him. So wherever you are in the world, he can definitely work with you. Like I say, one of the most knowledgeable people when it comes to peptides. So if I've got any patient where I'm like, they need a complicated peptide protocol, I'm sending them to Dr. Grinberg. So if you want to know more about what we do, please head to www.kidneycoach.com. You'll also find us on Instagram and Facebook under the same bits of information. Remember to hit subscribe and like. That way you'll get notified anytime we put up more information. And if you have questions for Dr. Grinberg, please put them in the comment section below and I will get them to him and answer them for you all. Dr. Grinberg, thank you so much for your knowledge, your time, and your wisdom. This has been a really informative and great podcast, and hopefully we'll answer all those questions that my menopausal women have had when it comes to CKD and kidney disease.